Hello dear students, welcome to this channel once again. So today I am going to discuss very important the topic, that is transposition of great arteries. It is also known as transposition of great vessels, TGV or TCA. Okay. So let's begin with the disease condition. So first one is definition. So transposition of great arteries, it is a cyanotic congenital heart disease in which there is a abnormal rise of aorta from the right ventricle and pulmonary artery from the left ventricle. Okay. What is the transposition of great vessels or transposition of great arteries? It is a cyanotic congenital heart disease in which aorta, which supposed to originate from the left ventricle, it originate or arise from the right ventricle. Pulmonary artery, which supposed to arise from the right ventricle, it originate from the left ventricle. Okay. So because of this, what happens here, severe sinuses occurs at the time of birth. Okay. So this is known as transposition of great arteries. Okay. Now, what is the incidence of this transposition of great arteries? It is more common among the male babies, and incidence is 5 to 10% of a congenital heart disease. That cyanotic congenital heart disease is of a transposition of great vessels. Okay. Now let us see what is the etiological factors. The cause or etiological factors of transposition of great vessels is alcoholism or smoking during pregnancy. If mother consumes excessive alcohol or smokes heavily during the pregnancy, that can lead to TGA. Next one, maternal insulin dependent diabetes mellitus. If mother suffer from type 1 diabetes mellitus or insulin dependent diabetes mellitus during pregnancy, that can be the cause for TGA. Next one is teratogenic infection. If mother suffer from any teratogenic infection in the first trimester of pregnancy, that is with the rubella, that can be the cause for TGA. Next one is teratogenic drugs. Certain drugs when taken during the pregnancy like thalidomide, that can result into congenital heart disease including TGA. Next one is chromosomal abnormalities. So this TGA is more commonly associated with a child with a chromosomal abnormalities like a Klinefelter syndrome, Turner syndrome, okay, Down syndromes. So these congenital heart diseases are more common along with the chromosomal abnormalities. Next one is it may also associated with other defects. This transposition of great vessels may be present okay alone itself, or it may be associated with other congenital heart disease such as atrial septal defect, ventricular septal defect, and patent ductus arteriosus. Next, this disease is more commonly found in a large birth weight babies. The baby with weight is more, okay, in such babies this. Now let us discuss about the pathophysiology. So what happens here? First, due to etiological factors, there is a structural defect, that is a transposition of great vessels or transposition of great arteries. Okay. So because of this, what happens here? Aorta that arises from the right ventricle and pulmonary artery which arises from the left ventricle. Okay. So because of this, what happens here? There will be, so first what happens here? Deoxygenated blood. So deoxygenated blood enters into right atrium through superior vena cava and inferior vena cava. After that, what happens here? Blood enters from right atrium to right ventricle. So right atrium to right ventricle, blood will enter, and after this, what happens here? Through the aorta, okay, through the aorta, okay, blood goes for peripheral perfusion. Okay. So here the deoxygenated blood without oxygenation in the lungs, directly it will go for the peripheral tissue perfusion through the aorta. So because of this, what happens here? There is hypoxia. Okay, and there will be severe cyanosis, and the baby with this kind of disorder will not survive. Okay, as there is no proper oxygenation of body tissue, so multiple organ failure will takes place, and baby will die. soon after the birth. Okay, soon after the birth, the death of the baby is takes place. Okay. So this is etiological factor. This is the pathophysiology. Here, what happens due to etiological factors, the condition that is transposition of great arteries or transposition of great vessels happens. So because of this, what happens here? First, deoxygenated blood enters into the right atrium. Deoxygenated blood enters into the right atrium. Okay, through the superior vena cava and inferior vena cava, and then blood enters from right atrium to the right ventricle. After that, through the aorta. Okay, directly from the aorta, through the aorta, blood go for the peripheral tissue perfusion without any oxygenation. So because of this, what else? This will lead to hypoxia and severe cyanosis. Okay, and death of the baby will takes place immediately. Okay, the survival rate is highly less in the case of this condition. Okay. Okay, now we'll see another side of pathophysiology of transposition of great arteries. Okay, suppose due to etiological factors there is a transposition of great arteries or transposition of great vessels. Okay, so if this TGA is associated, if it is associated with other structural abnormalities, okay, such as what? Such as, okay, atrial septal defect, okay, patent ductus arteriosus and ventricular septal defect. So in this condition, what happens here? Okay, in case of atrial septal defect, okay, what happens here? The deoxygenated blood enters into the right atrium through the superior vena cava and inferior vena cava. After that, what happens here? Due to atrial septal defect, there is a shunting of blood from right atrium to the left ventricle. Okay, so some amount of blood will shunt from right atrium to the left ventricle. Okay, so because of presence of this one, there is a shunting of blood from right atrium to, okay, left atrium. So because of this, what happens here? Now blood will move from left atrium to the left ventricle. Blood moves from left atrium to left ventricle, and then the blood will go to the, okay, through the pulmonary artery, blood will go to the pulmonary blood. Okay, so through the pulmonary artery, okay, blood will go for oxygenation. Okay, oxygenation. Then after that, what happens here? Oxygenated blood will come to the left atrium, and then the oxygenated blood will come to the left ventricle. So here, because of presence of this atrial septal defect, the blood will go for the oxygenation, and then oxygenation blood will come from left atrium to the left ventricle. Okay. After that, what will happen? Once the blood comes to the left ventricle, we'll see later. Okay. Now, in case of patent ductus arteriosus, okay, once again I will tell you, discuss about this associated congenital heart defect. That is, if transposition of great arteries, if it is associated with the atrial septal defect, what happens? The deoxygenated blood which enters into the right atrium through the superior vena cava and inferior vena cava, it enters into the right atrium. After that, due to presence of this defect, what happens here? The blood will shunt from right atrium to the left atrium, and then from blood will move from left atrium to the left ventricle, and through the pulmonary artery it will go for the oxygenation. So after the oxygenation, oxygenated blood comes to the left atrium, and then it will come to the left ventricle. So further we will discuss later. Okay. Next, if transposition of great arteries or great vessels, if it is associated with patent ductus arteriosus, then what happens here? There is a shunting of blood. Okay, there is a shunting of blood from high pressure. Okay, from high pressure. Okay, from high pressure in the high pressure in aorta to low pressure in the pulmonary artery. Okay. So what happens here? If TGA is associated with the patent ductus arteries, that is abnormal communication between the aorta and pulmonary artery, then what happens here? The blood will come to the right atrium through the superior vena cava and inferior vena cava. After that, blood will come to the right ventricle. Then after contraction of right ventricle, blood will move to the aorta. Okay, what happens here? Due to presence of this defect, what happens here? There is shunting of blood from high pressure in the aorta to the low pressure in the pulmonary artery. So because of shunting of this one, what happens here? There is a increase pulmonary blood flow, increase pulmonary blood flow, and then what happens here? Oxygenated blood. Okay, so oxygenation of blood will take place here. Then oxygenated blood, okay, oxygenated blood comes to left atrium, then it goes to the left ventricle. Okay, so what happens if PDA is present with the TGA? Okay, first what happens here? The deoxygenated blood enters into the right atrium through superior vena cava and inferior vena cava, and after the contraction of right atrium, blood will move to the right ventricle. After contraction of right ventricle, blood will goes to the aorta. Okay, then after what happens here? There is a presence of PDA. So because of presence of PDA, what happens here? There is a shunting of blood from high pressure in the aorta. Okay, deoxygenated blood will shunt from high pressure in the aorta to the low pressure in the pulmonary artery. Then blood will go for the oxygenation. There is a pulmonary blood flow, oxygenation. Blood will go for the oxygenation. After that oxygenation, blood will come to the left atrium through the pulmonary veins. Then blood will move from left atrium to the left ventricle. Later what happens? We'll see next. Next, if another congenital heart disease associated with the TGA, okay, that is one question of great vessels, that is ventricular septal defect. Okay, if all these three defects are present, then the baby will survive for some days. Okay, so that's another defect is VSD, ventricular septal defect. Okay, so what happens here? Due to presence of ASD, there is sending of blood from right atrium to the left atrium, and less amount of blood will come to the right ventricle. Okay, and due to shunting of blood from aorta to the pulmonary artery, there is increased blood flow to the oxygenation, and increased amount of blood will come to the left atrium, and then increased amount of blood come to the left ventricle. And here the pressure and volume in the left ventricle exceeds the pressure and volume in the right ventricle. So because of this movement, there is shunting of blood from left ventricle to the right ventricle. Okay. So what happens here? Once again, I wanted to clear you. So there are three defects are present. Okay, along with the transposition of great vessels. Okay, that is ASD, VSD, and PD. Okay. Now what happens here? Due to presence of ASD, atrial septal defect, there is shunting of blood from right atrium to the left ventricle. Okay, so some amount of volume of blood will go from right atrium to the left atrium. So because of this, some amount of volume of blood coming to the left ventricle, the volume of blood coming to the right ventricle, it has decreased because of shunting. And next what happens here? There is a movement of blood from right ventricle to the through the aorta, and again there is a shunting of blood from aorta to the pulmonary artery. So because of this what happens? Some amount of blood will go to for the pulmonary tissue. Okay, pulmonary blood flow. Again because of this what happens here? There is increased blood, oxygenated blood coming to the left atrium. And then what happens here? The pressure and volume in the left atrium and left ventricle, okay, increase. Okay, the pressure and volume in the left ventricle increase, and it exceeds the pressure and volume in the right ventricle. So because of this, there is a shunting of blood from left ventricle to the right ventricle. So because of this, what happens here? Along with the deoxygenated blood, there is a flow of blood, oxygenated blood to the peripheral tissue perfection. Okay. So due to presence of this VSD, there is a shunting of blood from left ventricle to the right ventricle. So because of this, what happens here? There is a increase oxygenated blood supply to peripheral tissue. Okay. Then what happens here? There is a oxygenation, input some oxygen, and cyanosis. Okay, cyanosis will be obviously present, but it is less severe. Cyanosis will be present, but less severe. Okay, compared to only presence of transposition of great arteries. Okay, if it is presented with other associated congenital defect like ASD, VSD, and PDA, the severity of cyanosis is less. Okay, so this is all about the pathophysiology of transposition of great arteries. Now let us see what is the clinical manifestation. So clinical manifestations are, first one is cyanosis. Okay, first one is cyanosis. Cyanosis is very severe and survival rate is very poor. Okay, survival rate is very less in case of when the baby is born with only transposition of great arteries. Okay, baby will not survive immediately. Death of the baby will take place. Okay, and cyanosis is very severe in case of existence of only transposition of great arteries. Okay, so serious cyanosis will be there. Okay, then there will be, because of cyanosis, multiple organ failure. Multiple organ failure will take place, and patient will have a, okay, that is a activity intolerance. Activity intolerance will be there. Then there will be dyspnea will be there, tachycardia, dyspnea, tachycardia, tachypnea, tachypnea. Okay, and next there will be, so there will be severe cyanosis, multiple organ failure due to lack of blood supply, lack of oxygen supply to the or many organs, and then activity intolerance, dyspnea, tachypnea, tachycardia. Apart from this, there will be restlessness. Okay, baby will have restlessness, irritability, irritability will be there, lethargy, confusion. Okay, lethargy, confusion. Okay, and failure to thrive, failure to thrive. Okay, so all these manifestations will be exist in the child due to lack of oxygen supply to the peripheral tissues. Okay, due to severe hypoxia and severe cyanosis. Okay, so this is all about the today discussion. So next class, in next video I will upload regarding diagnostic evaluation and management of transposition of great arteries. Okay, thank you very much.